student physical therapist today. My name is Joseph Kaufman. I'm going to be showing you how to properly use and size crutches. So these I've already sized, but to size them, what you would do is you put them so that the tips are about 6 inches at a 45-degree angle away from your little toe in front of you, so about there. And then you adjust the height so that you can fit about 2 or 3 fingers between the crutch and your armpit. And you do that on both sides, so these ones are fitted pretty well for me. Then you would also adjust the hand grips so that the grip is level with your ulnar styloid process. And then once you do grip the handles here, your elbow should be at a 20 to 30 degree bend of flexion. All right, so the different gaits that we're going to go through are 2-point, 3-point, 4-point, swing to and swing through gaits. So the first one I'll start with is a 2-point gait. What you'll be doing is moving one leg and the contralateral crutch at the same time, and then the opposite crutch and contralateral leg. And so you'll always have 2 points of support on the ground at all times. So it kind of looks like this. Nice and easy. So that's 2-point gait. 3-point gait. The one I'm going to show you is a modified or delayed 3-point gait. So let's say my right leg was my involved leg and weaker and only partial weight bearing. What I would do is I'd move the weakest base of support first, which would be the crutches. I would then step in heel to toe fashion with my involved leg, putting as much weight as allowed by the doctor on it. And then I would bring the strong leg to the level of my other foot and the crutches. And you just kind of keep going in that pattern. So crutches, partial weight bearing, full weight bearing, crutches, partial weight bearing, full weight bearing. And you just kind of keep going like that. So that's the modified 3-point gait. 4-point gait is when you have only one support off of the ground at all times. So it'd be one crutch, the contralateral side, then the other crutch, and the contralateral side. And you just keep going like that, bringing your foot to the level of the crutch. Yeah, that's 4-point gait. One support is always on the ground. And then we have swing to and swing through gaits. Those are typically used for patients with paraplegia, and they are often in long leg casts of some sort, so they can't actually bend their knees at all. So for this, I'm going to try and keep my legs straight the whole time to simulate having on these leg casts. What you would do for the swing to pattern is you'd place the crutches out in front, and then keeping your legs straight and the weight on both the hand grips here, you kind of just swing your legs to the level of the crutches and swing to gait. You just kind of go like that. And this is not especially fast, but it is the safest to start out with the patient just trying to use crutches who has paraplegia. So you have to try and keep the legs as straight as you can and just move it like that. All right, and then swing through gait is the same idea, except for instead of coming just to the level of the crutches, you'll actually kind of swing past, so your arms are in a little bit of an extension, and your legs are in front of the crutches each time. This is a little bit quicker and more efficient, but it is more difficult, so someone new wouldn't be as good at it. So I'll go ahead and demonstrate that now. So the crutches and then swinging through, crutches, swinging through. All right, and that is all of the gaits that we are teaching with crutches.